Hey guys, so this is ATI chapter 28. I thought I was going to do 28 and 29, but it's just 28. Fundamentals. This is about assessment skills and regarding the head, eyes, ears, nose, throat, neck. Okay. I did include this one little page extra slide here with some words that you need to know. Consensual reactivity. That means that both eyes respond equally. Inner canthus, that's the inner corner of the eye. Exophthalmos, bulging eyes. Boing. Strabismus, crossed eyes. Lower conjunctival sac, that's when you pull the lower lid down, right? Lacrimal gland, that's your tear duct, also here in the corner of the eye. Presbycusis, a decrease in the ability to hear high-pitched sounds associated with getting older, aging. And then presbyopia, a decrease in the ability to see items close to you. Okay. So here are some assessment questions that you should know when you're starting with the HEENT: head, eyes, ears, nose, throat. Do you get headaches? How often? Where? Do you have any other things like manifestations related to your headaches? In other words, when you get a headache, do you get sick to your stomach? Do you throw up? What do you do to relieve the pain? Have you ever had a head injury? You have any pain in your neck? Can you move your head and shoulders? Have you noticed any unusual involuntary facial movements, like a tick or a twitch? Does anyone in your family have thyroid disease? How well do you hear? Have you noticed any changes in your hearing? Do you wear hearing aids? Have other people commented that you're not hearing what they say? Do you ever have a ringing or buzzing in your ears, or drainage or dizziness or itching or pain? Do you have a history of ear infections? Are you routinely exposed to loud noises, whether that be at work or maybe you go to concerts with loud music? How do you clean your ears? Side note, never stick a Q-tip in your ear. Okay, that is a good way to puncture your eardrum, your tympanic membrane. You only clean the outer portion and that's it. Do you ever have pain, stuffiness, or fluid draining from your nose? Have you ever suffered an injury to your nose? Do you have nosebleeds? Have you ever noticed a change in your sense of smell or taste? Do you use any nasal sprays? Do you snore? Does anybody tell you that you snore? Do you have difficulty breathing through your nose? Do you go to the dentist? How often? Do you have dentures, retainers, partials? Do you have any problems with your gums? And do you have any issues with swallowing or problems with a chronic sore throat or hoarse voice? Okay, those are questions that you would want to ask. All right, let's get started. So we're going to start with the head and the neck. So the head and the neck, this includes the skull, the face, the hair, the neck, the shoulders, the lymph nodes, the thyroid gland, the tracheal position, carotid arteries, and jugular veins. Okay, so you're using inspection, palpation, and auscultation. Remember, look, listen, feel. Okay. Unexpected findings include palpating some sort of a mass on the head, limited range of motion in the neck, or enlarged lymph nodes. If the client's head size appears strange, big, or not typical, compare the circumference to a chart. Okay. And then we're going to test cranial nerves, but let's move on. Okay. What are the expected findings for a skull? It should be normocephalic. In other words, the size should be within normal limits. There shouldn't be any depressions, deformities, masses, tenderness. And overall, it should be pretty symmetrical. In other words, kind of equal. With the face should also be relatively symmetrical. Okay. If there's a droop, that would be asymmetry. You have to document that. Okay. Expressions when they smile. Is it an equal smile or is it like one side up and one side down? Any involuntary movements, like I said, like ticks or twitches or anything like that. So to test cranial nerve 5, motor, you're just going to ask the client to clench their teeth while you palpate these muscles and the temporomandibular joint, which is right here, right in front of the ear. And it should be smooth. And then sensory, you would test light touch by having the client close their eyes and touch their face with a little, either a wisp of cotton or a tissue, and ask the client to say something like, okay, when they feel you touch them. And then for cranial nerve 7, you're going to test facial movement and symmetry by having the client smile, frown, puff out their cheeks, raise their eyebrows, close their eyes, and show their teeth. So they're going to smile, frown, puff out their cheeks, raise their eyebrows, close their eyes tightly, and show their teeth. Okay. I'm not going to test you on these two cranial nerve tests, but I do expect you to know everything that's in the pink highlight. Okay. All right. With the neck should be symmetrical. The shoulders should be equal in height. The patient should be able to move their head pretty smoothly, chin to chest, ear to shoulder, like this, right? Okay. And chin up. So this is hyperextension and then lateral flexion, side to side. And for cranial nerve 11, put your hands on the client's shoulders and ask them to shrug their shoulders against resistance, right? And then ask them to turn their head against resistance to your hand, okay? Cranial nerve 11. Lymph nodes. I do not expect you to know where specifically all of them are, but you should know that there are chains of lymph nodes that are from the lower half of the head down into the neck, and you should palpate them and check for tenderness and enlargement, okay? And here are some pictures. So you have clusters of lymph nodes along the jawline, behind the mandibula, behind the mastoid process, down the neck, and also right around here, okay? The thyroid gland has two lobes. It's attached to your trachea. It is in front of the trachea and extends to both sides. Okay, so we're going to examine the thyroid gland. We are going to inspect the lower half of the neck to see if there's anything enlarged, see if there's a goiter. Normally, you would not see the thyroid gland, okay? If you can see it without doing anything, then that's a problem. You have the client hyperextend their neck, and that'll make the skin a little tighter, make you see better. Have them swallow, and you should be able to palpate the thyroid gland on both sides of the trachea. It should be nice and smooth, okay? Don't worry about auscultation of the thyroid. And there is a nice little picture of the thyroid. Okay. All right. And then there's the trachea. You should inspect the trachea, just visualize it. It should not deviate from midline. In other words, it should be right down the center. Okay. And then you look and see if there's any masses or anything like that, anything abnormal in that area. Okay. And then the eyes. Okay. Usually we're just inspecting the eyes. There's very little else that you have to do. We're going to test for visual acuity. Make sure you understand this Snellen chart. Okay, that's for distant vision. And then we're going to be testing for extraocular movements. Okay, so we'll go through that right now. Now, the Snellen chart, the client should stand 20 feet away. And you see, I've included a Snellen chart here, and it gives you what their vision is. If they can read this, it's 2200, pretty bad. They can read down here in one of these two lines, they're 2020, 2025, which is about normal, average vision, okay? If they have eyeglasses or contacts, make sure they have them on when they're taking the test, okay? Very good. And that tests visual acuity, which is cranial nerve 2. Extraocular movements and reactivity. Okay, so the 6 cardinal positions of gaze, that's where you make an imaginary letter H, okay, in front of their face. You have them follow with their eyes down and then this way and then up and then down, okay? There shouldn't be any jerky movements of their eyeballs, and the eyes should be symmetrically moving together. And then checking for perla. This is cranial nerves 2 and 3. Pupils are equal, round, and reactive to light and accommodation. Okay. What does that mean? When you look at the pupils, they're clear. They are equal in size. And I'm going to show you a size chart in a minute, between 3 and 7 millimeters in diameter. They're round. They're reactive to light directly and consensually. So in other words, when I shine the light into the right eye, both the right pupil and the left pupil constrict. When I remove the light, both of them also dilate. And then accommodation is when the pupils will dilate to see something far away, but as you move it closer and closer to the face, their eyes will converge, they'll look cross-eyed, and the pupils will constrict to focus on that object. That's accommodation. Here's a chart, okay? So the little dot in the middle is the pupil, 1 millimeter, 2 millimeters, 3 millimeters, et cetera, okay? Averages between 3 and 7, somewhere in this ballpark. Okay, so the expected findings for the eyes, they should be parallel. They shouldn't be bulging, exophthalmos. They shouldn't be crossed, strabismus. Their eyebrows should be symmetrical from the inner to the outer canthus. And you should be able to raise and lower them symmetrically, up, down, up, down. Eyelids should be able to open and close completely, okay, without ptosis. And ptosis is a droop, the upper eyelids kind of halfway covering the pupil. There shouldn't be any edema or redness in the area of the lacrimal glands, which are your tear glands right here. The conjunctiva, pink and moist. The sclera should be white. Sometimes people with very dark skin will have a little bit of a yellow tinge with some little brown macules in the white. The cornea should be clear and the lenses should be clear. They shouldn't look milky like with cataracts. Okay, and here you go. There's the conjunctival sac. And there is the eye. So this is, the canthus, the inner canthus of the eye, the tear duct, and sclera, conjunctiva, iris, and pupil. Okay, the ears. So the external ears, the top of the auricles, also known as the pinna or external ear, should meet kind of an imaginary line that goes from the outer canthus of the eye, right? And they should be about the same size, right? And kind of level with each other. The skin on the ears should be the same as the rest of their skin. You shouldn't see any lesions, deformities, tenderness, anything weird. You might see a little bit of cerumen wax in there. It's okay. When you're dealing with looking into the ear, for adults, you pull the auricle up and back. For children, you pull it down and back. Why? It's a different kind of shape when they're children. And the way to remember it is for children, children are young and they're little, so down and back. Okay, that's the way I remember it. And also you're going to be looking at jugular and carotid, so jugular veins, carotid arteries. You should be able to palpate them, never palpate them at the same time, one side at a time, okay? Or you can make the person pass out. Hearing. What tests do we do to test their hearing? We do the whisper test, cranial nerve 8. So we close off one ear and go to the other one and whisper sounds inside their ear. Just whisper without them seeing your mouth move and see if they can hear you. Do the same thing with the other ear. The client should be able to hear you whisper from about 1 to 2 feet away. The Rennie test is for conductive hearing loss, and Weber test is for neurosensory hearing loss. So you're using a tuning fork. With the Rennie test, and you got to know these, okay? You have to place the vibrating ding tuning fork against the mastoid bone and have the client say something like, okay, when he can't hear the sound anymore. And you want to note how long the client hears the sound. Okay. Then move the tuning fork in front of the ear canal. When the client can't hear that sound, document that length of time. Okay. So that's about conduction. And then the Weber test is for neurosensory hearing loss. You take the tuning fork, ding, and put it on top of the client's head and ask them if they can hear the sound in their right ear, left ears, or both ears. They should hear the sound, the vibration in both ears equally. Okay. That's a normal. The mouth. When you look in the mouth, the hard palate, soft palate, pink, whitish in color. The uvula, the little punching bag in the back of the throat, should be intact and midline. And when they talk, it should move. Tonsils. Tonsils are the same color as the mucosa in the mouth, which should be pink and moist. And usually you cannot see them. They're graded as a +1 to a +4. +1 means you can barely see them on either side of the back of the throat. +4 means they're really swollen and they're almost touching each other, almost touching the uvula. The gag reflex. Use a tongue blade to stimulate the back of the throat. Make sure you explain what you're doing before you do it, and the client should go, okay? Their speech should be clear, articulate. They should be easy to understand. Their lips, right, should be symmetrical. They shouldn't have any lesions on them. Their gums should be nice and tight against the teeth, no bleeding, and pink in color. Mucous membranes in the mouth should be pink and moist. The dorsal surface of the tongue should be pink with the presence of papillae, little bumps, and it should be symmetric. And the other underside of the tongue is smooth, and the tongue is midline. So when you ask them, stick it out, it's midline, okay? And it moves freely. The nose is midline, symmetrical, same color as the face. There should be no tenderness or swelling or masses or any deviation. And each of the nares, nostrils, are patent without the patient flaring. And the structure is firm and stable. Sinuses. You can palpate the frontal sinuses. Press with your thumbs below the eyebrows on either side of the bridge of the nose. Okay, here. And then you can palpate maxillary sinuses right here. Press, and you just ask the patient, does this hurt? Is this tender? Expected finding, it should be non-tender. Okay. Here is a sample of what a good chart looks like. For HEENT, client reports no pain in head or neck region. Skull is normocephalic, symmetrical, and non-tender. Symmetric facial features and movements. Trachea is midline. Thyroid lobes are palpable but not enlarged, no nodules. Neck supple with no palpable lymph nodes. Full range of motion of neck. Visual acuity 20/20 in both eyes without correction. Extraocular movements are symmetric with no strabismus or nystagmus. Nystagmus is when your eyes quiver, kind of like pinballs. Peripheral fields are full bilaterally so they can see, right? Eyebrows are even, eyelids close and open completely without ptosis, no droop, no discharge. Conjunctiva is clear, pink, sclera is white. Irises, in this case, are blue, but whatever color they happen to be. Cornea and lenses are clear. Perla, no lesions or tenderness. Tops of ears align with the outer canthus of the eyes. Tympanic membranes are gray and translucent. Auditory acuity is intact to whispered voice bilaterally. Negative Weber test, nose is midline and symmetrical, nares are patent, nasal mucosa is pink, septum's intact and midline, no discharge, no sinus tenderness. If you want to put something about the lips being darker pink, intact and symmetric, that's fine. Oral mucosa, pink and moist, no dental caries, those are cavities, no missing teeth, tongue is pink and midline. Papillae on dorsum, symmetrical vascular pattern, underside of tongue, gums are tight, no bleeding, hard and soft palate's intact, uvula midline, gag reflex present, tonsils +1 bilaterally, speech is clear, cranial nerves 1 through 12 intact. And there you would drop the mic. Questions? Let me know. Until next time, I will see you guys.